Hi, hello, welcome back. So today we will be seeing about modifier 33 preventive services. Okay, so it is a CPT modifier which we will be using for adding up with the CPT code this special modifier which is preventive service. So first of all we have to know what is the definition. What is modifier 33? Modifier 33 is used to indicate that a service is a preventive under applicable law of regulations requiring no patient cost sharing. Okay, so then we have to know, like when you are studying this, first of all understand for preventive services we will be using this 33 modifier. Okay, when to use 33 modifier? It should be appropriate, for instance, colorectal cancer screening, mammograms and immunization. For screening purpose, for mammograms and for immunization we will be using, and for an annual visit also we will be using this 33 modifier. I have given a coding example, so you can read the question and see. And since here to check for colorectal cancer, that's why we are adding here 33 modifier, as well as here in the second question preventive health checkup, mammogram as a part of preventive health checkup, that is a keyword here. That's why we are using 33 modifier along with this CPT code. Okay, so and the third here it is immunization. The patient is here for immunization. That's why we are adding 33 modifier along with the vaccine code. So this is all about 33 modifier, that is preventive services. Please go through each examples carefully, and documentation tip is clearly document the service, and second we have to check for the guidelines, and third detailing of the services, like what is the type of preventive service, use, patient age, and qualify the service of modifier 33. All these things should be checked, and common mistakes to be avoided is incorrect application. That is, we should not add 33 modifier unnecessarily, and if there is incomplete documentation also we should not use 33 modifier. So this is all about 33 modifier. Thank you so much for watching my video. If you haven't subscribed, please do subscribe and share it with your friends, and if you find it useful, share it with your friends. Okay, and if you have any doubts, put it as a comment. Thank you, take care, bye bye.